So before we talking about the children's problems, let's thinking about what's the difference between the children and the adults. So something special, something we're looking for something special. So generally speaking, for children's problems, quickly changing. So quickly changing, including two parts. One part is the illness part. Illness, like a progresses pretty fast. Like we see our children, in the morning, looks everything's fine, play and happy, and suddenly afternoon, go to afternoon, suddenly feel sick, don't like moving, don't like eating, and then go to the evening, patient maybe totally couldn't move, just lay down and in the bed and short breath, high fever. So illness pretty faster development, pretty changing pretty faster, just kind of a few hours. That's one aspect for the illness. Another aspect is pretty faster or repeatedly faster recover. Like we talking about the same children, looks pretty sick from the noon to the evening. But maybe after treatment, the children recovered pretty faster. Like next morning, he play again, happy again, and running again. So that happens for the children. Quickly changing, Compare with the adults. Adults illness usually is not that faster getting worse and not that faster getting recovered. But the children truly, when they got illness, pretty easily getting worse and pretty easily get recovered. So that's the first special. And the second special, we're talking about the children is more young, more young bodies. We're talking about some detail later. So basically we know like a yin-yang balance usually inside the body. So in part is more relationship with like a structure of the body, like organs, like a qi and the blood build up. And the yang more relationship with activity of the bodies, like functions. So for the children, they are not truly balanced yet. So basically their body not totally development. So there are in part kind of difference there. Yang part is kind of hyper in there. So we're always talking about for infants, they are more young compared with Yeah, they are more young. Like they are more mutable. They are like play, they like running, but they are in part their bodies not totally built up yet. So that's the second aspect. The third aspect, children's problems, is not truly relationship to big emotions. Like when you go to our clinic, like you treat for adults. I believe more than 90% of the patients, they will have different degrees, their problems, relationship with emotions or stress. So basically, when we make our pattern diagnosis, like most people, we will have like a liver qi stagnation, and then with other issues. That's for adults. But for children, their emotions problems is not like a big emotions like the adults. So that's we say emotion is important. And then we talking about the children. They will more essence. When we talking about essence here, we mainly talking about kidney essence. So where the kidney essence coming from? Coming from the parents, coming from the mom and dad. When they just born, they have the whole essence coming from mom and dad. And gradually follow people getting aging and aging. They using essence. So gradually essence will be getting kind of different. Especially we're talking about for aging people, sinners. They always have essence difference. And then another aspect is we say usually spin qi difference because their organ not totally development yet. Certainly not only spleen, maybe other organs also, like the lung, like the heart. We will talk about some detail later. But the more important part is the spleen. Because spleen is the part we got the post-natural essence. We talk about the post-natural essence coming from parents. They will be gradually decreased. So people need a post-natural essence to support. But for children, their spleen not totally maturity yet. So they always have spleen qi difference. So that's the general picture of for children compared with the adults. Then we're talking about some detail one by one. Firstly, we're talking about the physiology part, relationship with the children. So physiology means normal body functions, yeah, physiology, normal body function. Certainly pathology, relationship with the illness. So let's go to physiology first. Yeah, physiology. Physiology including few parts, including few parts. Firstly, we talking about growing. Growing including body weight and including how long. We put how long here. Truly is how high. Yeah, truly is how high. But new babies especially always lay down there. Yeah, always lay down there. So that we use how long it is. But truly is how high it is. So we have some number here, like a new baby, around 3 kilograms. We have some range. Yeah, we have some range. We are not exactly the same number here, but we have some ranging here. So we say around 3 kilograms. So if 2.5 kilograms still okay, but if less than 2 kilograms, truly that's too less. That's too less. So generally, like early burning kind of babies, their body weight usually will less than 2 kilograms. And a little bit bigger, still okay, but too bigger usually cause not baby's problem. It's mom's delivery's problems. So like some baby over 5 kilograms, so truly caused difficult delivery. But for the babies, it's no problem. For the low body weight, for the babies, their development may be slow. And follow the aging, like the baby getting bigger and bigger, and their body weight getting higher and higher. So we still say that originally body weight in here. If less than these numbers, usually is poor nutrition. So slightly less, still okay. Slightly less, still okay. So basically, if you're tracking, usually they will have a detail about the different age and the range of the like a body weight and how high it is. I just gave you some simple here. If too heavy, we still don't suggest it because later on maybe cause the children overweight. So we pick up something around 8 kilograms to 12 kilograms for 1 year old babies. But generally speaking, the boy will be a little bit heavy compared with the girl. It's not a too big difference for baby, but still a little bit difference. And certainly, When 2 years old, they will get more body weight. So that's the body weight part. Then how high of the baby? Yeah, we still have some range there for centimeter. And the baby getting longer and longer, or maybe higher and higher when they grow up. So that's for the generally body weight and length. Generally speaking, the baby follow the age will be getting more heavy and heavy, and they will be more higher and higher. Secondly, we're talking about the teeth. The new babies, they will don't have teeth. From 5 to 9 months, some teeth will be coming. Usually, lower part coming first. Then 8 to 12 months, upper part is coming. In 3 years, 3 years old, the children. So that's like all the baby kids' teeth will be coming out. So for human beings, for the life, we have 2 kids. One is baby kids. Yeah, baby kids is 20. Totally is 20. Yeah, 10 above, 10 below. 5 left side upper, 5 left side right, 5 right, 5 left side lower, 5 left side. So like the teeth numbers here. Upper, low, left, right, and right. It starts from 5 months and to 3 years, they totally coming out. And then some of them start to falling down when they totally coming out. So then when they falling down, they will changing to adult teeth. So adult teeth is 28 to 32. For adult teeth, they come in 28 first. Another 4 around 20 years old. They will come in like originally each side 7 there, totally 28. Then some people call it a smart teeth will be coming. But truly for some people, they may for their whole life, they didn't come in the last one. Some people maybe only have 28. Some people have 32. That's for the adults. But for the children, we say from 3 years old, all teeth coming, and some of them start falling down, and When 6 to 12 years old, adult teeth will be coming. We're talking about the timeline here. We're talking about the baby's development. So baby normal development will follow like the number here. Certainly, if they are slow, we say start from 5 to 9 months, the teeth will be coming. But if some children, like over 1 year old already, like after 12 months, no any kind of teeth coming, that means slow development. Usually, like they coming a little bit early, it's not trouble. But if we cut it coming late, that's slow development. So that's about the teeth. Then we're talking about the birthing rate. Before we talking about for adults birthing rate, we talking before we talking about the children's birthing rate, we talking about the adults birth. So generally speaking, for adults birthing rate is about 12 to 15 per minute. While respirations, including inhale, exhale, that's normally around 12 to 15. So certainly some people like after exercises maybe more faster, and some people always do some physical activity. And then when they just lay down there, rest there, the respiration rate maybe little bit slow, similar like a heart rate. But something around there, something around there. That's for adults. Generally speaking, more young kids, their respiration rate more faster. That's because their lung not totally development yet. They need a faster birthing. Then they can get enough oxygen sending to all of the body. So that's we say less than 3 months, the normally birthing rate can go to around 40 times per minute. So pretty fast. So if you see some new babies, they're pretty fast respiration rate, don't tell the mom your baby is sick. So that's the normally habits for the baby. And when they getting a little bit older and older, they are lung is development and maturity. So basically, like go to 3 years old is around 25 to 30. Like 6 years old, they will be around 20 to 25. Generally speaking, over 12 to 16 years old, their respiration rate pretty close to the adults. So that's about respiration rate. Yeah, respiration rate. Because their lung not totally developed. So they try to breathe faster. And then they can take enough oxygen. So certainly the small case, their lung is smaller. So air changing happens in the lung. It's small air in there. So like this is the adult's lung. That's the infant's lung. So you can compare, the space will be different. So that's about the birthing rate. Then we're talking about the heart rate. The heart rate. Heart rate pretty similar like respiration rate. But heart even development faster compared with the lung. So heart rate for new babies pretty fast. We say normal adults heart rate, we say normal range 60 to 100. Per minutes. And we're still talking about some people do more exercises, may heart rate. Let me go to lower part. And other people maybe more go to higher part. But the normal range here. And the new babies, you can see, compare with adults, kind of double rate compared with adults. And then when they getting older and older, their heart rate will be decreased gradually. You can see, generally speaking, 7 to 9 years old, their heart rate pretty close to the adult. So that's the heart rate. So still, when you're like checking for the infants, if you find that their heart rate is faster, and especially when you feel the pulse. So generally speaking, for most case, pulse rate will be the same with the heart rate. So when we're talking about heart rate here, we say rapidly or faster. That means when you feel the pulse will be rapid. So for the children. So generally speaking, for TCM, we say if heart rate or pulse rate is faster, we say that's some heat condition. But for children, there are naturally or physical conditions. Their heart rate will be rapid and the pulse will be rapid. So it's not necessary for the children. We say the heat condition. So that's some generally physical growing of the children. So that's we know, like children growing and development pretty faster, including the whole body. We just put something like important here, but truly, functionally, like a nervous system development also. So that's basically for children and their development. And another important part for children development is their bone. Especially the bone in the head area. So our head area, the bone, like here is the top of the head. They have some bone, like when they just delivery, they have some space between the bone and the bones. So that's we're talking about the fentanyl. Yeah, fentanyl for children. We have anterior fentanyl. We have posterior fentanyl. And the side part, yeah, we have anterior side part, yeah, anterior lateral fentanyl, and posterior lateral fentanyl. So generally speaking, for the new babies, they will have 6 fentanyl. But lateral fentanyl usually close 2 to 3 months. And the posterior fentanyl usually close 6 months to 1 year. Just the anterior fentanyl, it is bigger. Yeah, it is bigger. It close pretty slow, pretty late. So basically, it will be close around 1.5 years to 2 years. So when we're talking about the fentanyl here, we need more pay attention, especially people under 2 years old. When you do needling, yeah, when you do needles on the scapular area, especially pay attention to anterior fentanyl. Even we're talking about it will be closed around 2 years. But even patients like 3 years old, when they go to acupuncture treatment, we still need to use our hand touching the local skin there to see if it is still softer there. Means only soft tissue in there. The bone still not fusing yet. The fentanyl still not closed yet. So in that kind of case, no needles in that area. So if patient's fentanyl not closed yet, no needles, including other fentanyls. But truly anterior fentanyl is the latest closed one. If the later fentanyl is closed, other fentanyl will be closed. So always touching there to see if they are not closed. No needle there. Certainly, if patients will have different timeline here for different fentanyls, if they are like after timeline, their fentanyl still not closed, that means slow development. Yeah, slow development. So children or kids, slow development will not only happen on the bone, they will also slow development for internal organs. So that means their organs function will have different degree kind of deficiency for slow development kind of children, including their lung, spleen, and heart, mostly. So that's we use different numbers to measurement for the children. That's basically we got some basic idea about how children development and how their organs functions look like. It's normal development, like matching the number here. Thus their body will development properly. If slow, compare with normal number there. That means their slow development, including their bodies, including organs, and also affected their function. So then we're talking about two important parts with pediatric physiology. So basically we're talking about already. We just go to some detail here. So the first part is the 脏腑 organs in maturity. So that means their functionally is not totally proper, like a kind of deficiency here. And the second part, still pretty similar, we're talking about already. Rapidly growing and development. We just go to some more detail here. So now we're talking about from TCM aspect. We're talking about the 脏腑 organs, not maturity. And the qi and the body not stronger yet. So that's basically when you learn foundations, you learn that part already. So that's coming from 黄帝内经. Also translator for Yellow Campus. Yeah, Yellow Campus internal book. So that's the oldest TCM book. So certainly TCM development longer than this book. We have some other books before, but it's losing. Yeah, it's losing. So up to now, we have the oldest TCM book is 黄帝内经. So 黄帝内经 including 2 books inside. One book we call 素问. That's the P name here. And the translator, basic question or planting questions, the translator will be different. And the second book is 灵书. So basically in 素问, talking about like human being development by the time circle. So for the girls, the time circle is 7. Yeah. 7 times 7. So like every 7 years, their body have a big changing. So that's we talking about 7 years old, the T will be changing from children's T to adult's T. And more hair grow. And when reaching 14 years old, we say 天癸 coming. So that means for the girl will have periods. And they will able to have babies. So certainly 冲脉 and 带脉 is more smoothly. Yeah. So that's will able to have babies. Yeah. Menstruation period coming. So that's basically we're talking about gradually development to 14 years old. Not go to the top part yet. Yeah, not development to the top part yet. But generally speaking, to 14 years old, all the organs is functional, even can have babies. So for the boy, the time circle is 8. Yeah, 8 times 8. Yeah, still around 8 years old, the T will be changing. And 16 years old, kidney T is strong. So 天癸 still coming and still able to have babies. So that's we're talking about general development from TCM aspect. Then we're talking about the different organs development. So lung in the young children. Is not that development. So like we're talking about the new babies, pretty faster birthing rate. That means their lung not totally development yet. And when we talking about lung, we always talking about the spleen also. because those two organs directly relationship the functionally is qi. So clinically, when we talking about lung qi deficiency, we tonify qi, we also pick up some points from spleen channel. If we try to tonify spleen qi, we still can pick up some points from lung channels. Because organally their relationship is the mother and the son's relationship. So spleen is the earth, that's the mom. And the lung is the metal, that's the son. And also spleen functions depending lung functions normal, depressing and descending. So when we're talking about these two organs function normally, they will send in nutrition to whole bodies. We say nutrition coming from middle jaw, including the spleen and the stomach. Absorptions. But sending all over the bodies, sending all over bodies. Usually we're talking about heart. Because heart pushing the blood go to all of the bodies. But in TCM, we're talking about a long relationship with 100 blood vessels. That's mainly we're talking about lung have functions to sending nutrition to all over the bodies. So that's what we're talking about here. These two organs, right spleen, absorptions, nutrition, right lung, sending nutrition all over the body. But for the children, their spleen functions usually is different. Yeah, beside the lung is connected with 100 blood vessels. My bad writing here. Yeah, 100 blood vessels. Yeah. Yeah, when you're sending questions, you can send in for everybody. So when I answer questions, other people know what I answer for. Yes. So that's for children. Yeah, for children. We say usually have lung qi deficiency and spleen qi deficiency. So both lung and spleen usually is deficiency. So lung qi deficiency have another situation. Young children easily got EPI evading. Like they're pretty easily got a common cold, cough, and asthma. So that's another aspected relationship with the dysfunctions or immaturity of lung functions. But generally speaking, for children, They are lung function, not maturity. We can thinking about some difference in there. So that's the first organ. Then we're talking about the spleen. Spleen also usually immaturity, usually deficiency. We know spleen control of our digestive functions. That's our nutrition coming from, qi blood coming from. And also for the young children, they grow seem pretty faster, like we talking about before. Like a few years, the weight increased and their hair increased, the organ development. So they need more nutrition. They need more even compared with the adults. More nutrition can support for the essence, qi, blood, body fluid. So that's one side we need more, one side poor functions. So that's basically for the children. The TNT functions not totally development. So that's kind of difference in there. So TNT functions not totally development. The digestive functions is weaker. So that's what we say for the young children. Always need easy digestion food, like a softer, cooking longer. Yeah, generally say cooking longer make the food more softer and easy digestion. So some food easy digestion, some food little difficult digestion. So we need to pick up special food for the children. So that we know for the children, just the delivery. The only food they can eat is the milk. Later on, they can eat something like eggs. Then some kanji coming from the rice. And gradually, they can eat more and more vegetables, meat, and then until adults. But for the children, if you suddenly give children lot of food to eating, they may not able to digest it properly, and also cause more spleen deficiency, and maybe cause the food stagnations, and even sometimes cause the children vomiting or maybe diarrhea or appetite. So keep in mind, yeah, young kids, their spleen function is kind of different also. Then we talking about the kidney. Kidney mainly function part is kidney essence. Kidney essence, yeah, kidney essence. That's we say coming from the mom and coming from the dad. So how people stronger for the kidney? So usually coming from like how stronger essence they got from their parents. So sometimes when we're talking about like young kids, if they have some trouble, like asthma, some kids have asthma pretty early, around 5-6 years old, usually. That's usually some genetic reason. Kidney essence is not that strong. And also, we know some young kids, they couldn't control their urebladder. Like they always get pee during the night. Yeah, wetting bed. Yeah, wetting bed kind of problems. So that's usually still belong to their kidney essence, not that stronger, not that stronger. And also for the girl, yeah, also for the girl, like they're pretty late for menstruations. We say for time cycle for the girl, around 40 years old, they should be have menstruations, should be have periods. But if kind of pretty slow, over 80, or even over 20, yeah, over 18 or over 20, still no period. So that's truly belong to kidney essence deficiency. So like we know some disorder, if they got trouble pretty young, that's a relationship with kidney function and the kidney essence deficiency, including slow development. And we're talking about fentanyl didn't close. That's we say unformed scar in there. So fentanyl didn't close. And the slow development. We will talk about these illness later. Yeah. Yeah. File retention syndrome. Just means slow development. And 5 different kind of weakness. Yeah, weakness. That's the relationship with kidney deficiency. And couldn't control urinations. In urinations, that belong to kidney deficiency. So kidney deficiency, yeah, kidney deficiency kind of problems happens in a lot of cases, But sometimes we're talking about like some kids, they got asthma when they were very young. But like they over 15 or 16 years old, or even 20 years old, they recovered. They recovered. So that's their poor natural acid deficiency. But later on, they post natural acids to support the body and then get the body stronger. So that's we say young kids is easily getting sick because their body not stronger yet. So that's about the kidney. Then we're talking about the heart. The heart function still not matured yet. So heart in TCM function. governed blood vessels, and also control the Shen spirit. So that's we're talking about the heart not totally development yet. So we're talking about before, like a heart rate will be faster, yeah, because we don't have stronger heart qi. And also their Shen not totally development yet. So they are timid, and their mental states not stable. So that's basically relationship with the heart functions from TCI. Then the liver. So liver functions still not maturity. So liver functions, Shu and Xie. So that means smoothly moving qi. Yes, smoothly moving qi. So that's when liver function not maturity yet. So children have the problems, relationship with the sinners and attendants, like people pretty easily cause the problems, muscle spasm and convulsion. Like children, yeah, children got a common cold. So common cold for the adults, like a pretty common sick, usually not cause severe kind of problems. But for the children, it's different story. They can get high fever, just coming from common cold. And children's high fever pretty easily cause convulsion. That's because the liver function not maturity yet. They couldn't control internal wind. Yeah, they couldn't control internal wind. So liver itself belong to wood and the relationship with wind. So that's for the liver function. So generally speaking, for the children, 5,000 organs all not totally development yet. They all have different degree kind of losing functions in different aspects. So that's for the children, physiology part, TCM physiology part. And then another aspect we talking about the children's their life is poor high activities and poor rapidly growth and development. So if you're looking young children outside in the street, they always try to running. Yeah, they play games together and they always moving. Yeah. look like they have a lot of energy. They never talking about the tired. So if you're looking at children truly try to stay in the room, lay down in the bed, they truly sick. Yeah, they truly sick. Otherwise, they always moving. They never try to stay in one place. So in that kind of case, and also they pretty rapidly growing and development. So that's we say young children have more young. So what's that more young? What means more young here? You can thinking about when we talking about 5 elements. We talking about the yin and the yang, the circles, like midnight. From the midnight, some yang start. So midnight organ relationship, we can thinking about kidney. Then go to like the early morning, morning time, organ relationship, we can thinking about the liver. So seasonally, you can thinking about more in time is the winter. And the morning liver seasonally, you can think about the spring season. Yeah, it's not the spring August. Yeah. And then is the noon, is the summer. Then is the afternoon or fall season. So that's the yin yang circle. Yeah, yin yang circle. So yang time, yeah, yang means everything growing, especially from the spring season to summer season. So that's the yang. Yeah, that's the yang. So the children just like everything growing faster. So that's we say it's more young. It's more young. Or some people we talking about is pure young. The pure young theories. We talking about is pure young. So that's in the young children. Yeah. They getting stronger and stronger. And certainly yin yang is balanced there. And the yin increase also. That's then their body getting stronger and stronger. So that's normally for the children. Yeah, normally for the children. Growing faster. So that's our physiology part. Yeah, physiology part. Then we talking about etiology part. Means what caused the problems of the children. So easily cause children's problems. We have few aspects. Yeah, few aspects. External reasons. Yeah, external reasons. And food reasons. Congenital reasons. Sometimes emotion reasons. And accidents, or maybe other reasons. We're talking about each aspect, some detail one by one. Like what's the reason it causes the children's problems? So external passengers. We're talking about the children's lung not development yet. So lung qi deficiency. That means defending T or Wei T deficiency. So external passenger pretty easily evaded. When we talk about the external passenger, we always talking about the 6 passengers. Yeah. Wind, cold, summer heat, dampness, dryness, and fear. But clinically, the passengers is not coming itself. Like usually we are not talking about passenger wind coming itself. Usually we say wind cold or wind heat. So passenger wind, they can bring other passengers coming in. Like we talk about the wind can cause 100 different problems. What's that mean? They can carry other passenger go in, and they're moving faster, so cause the different kind of problems. So that's generally say 6 passengers. And then we have another special kind of condition, still belong to external passenger, but it kind of more severe kind of condition. Sometimes we use the words for toxins. Like a toxin heat. That's the most case. So these kind of external passengers caused like people sick, kind of group kind of people pretty easily getting sick. Like right now we talk about COVID-19. So COVID-19 still belong to external passenger in TCM. But they cause more severe troubles compared with 6 passengers. So we just put another group here, or sometimes influenza. Will they cause trouble? It's not like just 1 or 2 children or even adults got sick. They're suddenly coming, and they cause the epidemic kind of problem, like a lot of people getting sick same time. So that's the external reasons. Yeah. External reasons is pretty easily cause children's problems because there are lung qi difference and wei qi difference. Like from the beginning, some people talking about COVID-19 not affected of children, but not true, not true. Just during that time, like children don't have so many chances to contaminate with the COVID-19 virus. So right now we truly hear a lot of children got the COVID-19 infection. Some of them even died. Yeah. Because their lung qi deficiency, their wei qi deficiency, they are easily got external passenger EVT. And another problems cause people getting sick, especially for children, for food and the milk. Because there are spleen qi deficiency, their digestion is weaker. And their poor digestions, and also for the children, it's pretty hard to control the amount the food they take in. Like some delicious, they just eating. They like the delicious. But after eating, they are not able to digest all of the food they eat. And maybe also sometimes people feeding the babies, they don't know how much they should feeding the baby. They just give the babies too much milk. So still cause the poor digestion or food retentions. So that's further then cause more severe spleen deficiency and maybe disorder of the stomach, like people eating too much food retention in the stomach. Then they will vomiting, nausea, and even cause diarrhea. So that's can caused by the food. Yeah, can caused by the food. Even amount, over amount may damage spleen function. I think in Chinese we have a sentence talking about if we try to keep the children healthy, especially not eating too much, we say 30% hungry. Not eating totally full, 30% hungry. And 30% less clothes put on. Means don't put too much clothes on the bodies. That's we're talking about young people. They are more young. Their body is more yang qi in there. If you put too much clothes to cover, they may easily generate some heat condition. So keep children healthy, not overfitting, not overcover. So that's basically for our TCM. And the congenital reasons truly can cause some children's sick or illness. Certainly for Western medicine, we're talking about genes. For the TCM, we're talking about kidney acids. So if they have some genes or kidney acids problems, they will getting sick. Like we're talking about like some children that are pretty young, they getting asthma or other illness. So most the case is kidney disease problems, yeah, or genes problems. And certainly, when people kidney disease deficiency and meeting the same passengers, that we talking about environment factors here, they are more easily compared with other children, more easily getting sick. So that's another reason children getting sick. Genetic reasons. Genetic reasons. Emotion reasons. Emotion reasons. So generally speaking, children's emotions is more simple compared with the adults, but there are differences from the adults. Adults have more complicated emotions, but children's emotions, pretty simple, pretty simple. They want to eat, they want to eat. They want to warm. They want to happy, like the parents holding them. Don't put them beside, yeah. But that still kind of emotions, still kind of emotions. So if long term children have emotions troubles, still possible cause the children sick. But compared with adults, they are much less. Much less. Then accidents. Accidents for young children, pretty common. Pretty common. They may play something, then they put it in the mouth. Then by accident, something falling down to the trachea, blocking the trachea, or maybe one side of the bronchus. That's pretty severe kind of problems. It need emergency to get treatment. Otherwise, people may be dead from it. So that's kind of accident. Or maybe they injure themselves with some tools or whatever. They couldn't protect themselves properly. So they may have a lot of accidents or injuries happen for the young children. So we need to very be careful for the children. So that's common accidents, including they falling down, injure themselves, or burning. So originally we have some hot pot like this one. There's a pretty sad story here. Like 20, 30 years ago, people use a hot pot, like this. In China, at least. They always put boiling water in there. I have a classmate. She have a case. That's a boy. He's about 2 years old, and she sent the boy to grandparents to take care. During that day, the grandparents put some boiling water in hot bottle, but they put the hot bottle pretty small table there, a pretty small table there. And the children truly reaching that hot bottle, and all the water coming out, and burning the baby. Yeah, burning baby. It's around 2 years old. And immediately sending to hospital. And leaving hospital about 2 weeks. Emergency kind of treatment. But finally, the baby still died. So that's coming from the burning. It's accident. It's a pretty sad story. It truly happens. It truly happens. So pay attention. Anything, try not reaching by the children. Yeah, try not reaching anything. Yeah, anything, knife or whatever. Yeah, even ball, whatever. Try not reaching by the children. And some knife maybe also injured also. And electrical, yeah, electrical, good protections, yeah, good protections. And also, yeah, also some like drugs, medications. Be careful. Put away from the children or you lock it. Just because maybe some accidents maybe happens and then cause the dangerous situations for the children. So that's accidents. And certainly beside it, yeah, beside it, we may have some other reasons can cause the children sick, like environmental pollution and some food contaminated by the bacteria, maybe, or maybe some parasites and some other things, radiations or whatever. So lot of things possible cause the children sick. So keep in mind. Keep in mind. So that's the physiology part. Yeah, we talking about for children, and also we talking about some reasons possible cause children's getting sick or problems. Then we talking about the physiology part. So physiology part for children. So basically we talking about from two aspects. So we're talking about before already. Easily onset and rapidly changing. Second aspect that we talk about is more yang qi there and more clear 脏腑 organs qi. And the people, children getting sick, recover quickly. So basically, we just go to some detail here. We're talking about the idea already, but we just got some more detail here. Firstly, we're talking about easily onset and rapidly changing. So that's mainly we can talking about from different systems, illness. Firstly, we're talking about the lung systems disorder or illness. Lung organ is a pretty delicate organ. and it controls the skin and the superficial of the bodies, and it controls the pores and the sweating gland. So like we talking about before, young children, their lung qi kind of deficiency, not totally development. So that means their superficial wei qi deficiency also, not that strong. So young children pretty easily got a passenger EPI evading. So that's we say young people pretty easily got like a common cold and even flu infections. And their control the pores open and close, not totally development. So that's kind of weaker in the superficial of the body. So that's for lung system illness. We say they pretty easily got a common cold or maybe flu. Yeah, maybe flu. So EPI evading. Yeah, EPI. That's talking about the lung. Talking about the lung. Then we're talking about the spleen. Yeah. Like we talking about before, spleen functions not maturity yet. And spleen function not maturity means TNT functions not totally developed yet. So that's basically the children's problems. We say they are poor digestion, but they always try to eating more. Yeah, try to eating more. Yeah, if they can eating themselves, they always try to put everything in the mouth, even something couldn't eat it. You still can see some children put their toe into the mouth. Yeah. So that's another problems we're talking about, digestion problems, pretty easily to happen. Like young children, pretty easily cause poor digestion, like diarrhea. Yeah, diarrhea. And sometimes vomiting, nausea. So that's basically happens for the spleen system disorder. We say diarrhea or vomiting. If just short-term problems, it's not that big trouble. But if chronic diarrhea happens, that truly will cause the children's poor nutrition. Yeah, will cause the children poor nutrition later. Yeah, poor nutrition later. So that spleen is very important. Yeah, very important. Then we're talking about kidney and the relationship with the illness. We say kidney store the essence and governed the ball, and the ball holding the marrows. The marrows supports the brain. We say brain is the seat of the marrows. Brain of the seat of the marrows. So kidney losing functions. Most case for the young children is a congenital kind of disorder, genes disorder. So if young children have kidney iron deficiency, they will be pretty slow growing and development. So like we talking about before, functional growth slow or later. The teeth growing slow. And the body weight slow. The hair of the body slow. Everything is slow, including internal other organs. And also we can see some people, like their brain have some disorders from their birth, after their birth, like they couldn't speak. So that's generally speaking, that belongs to kidney iron deficiency. So kidney functions even more important in young children because they control all over the body's growth and development. So if patient have kidney iron deficiency, they may cause a lot of other organs, slow development, and losing functions. So like cause the other organs immaturity. So kidney is pretty important organ for the case. And some problems if kidney relationship with TTM certainly. But for Western medicine, we're talking about the genes disorder. It's pretty difficult to treat. Yeah, pretty difficult to treat. So that's for the kidney. Then we're talking about heart and the liver. We put heart and the liver together. So that's usually it's kind of unbalanced in there. Yeah, still not that maturity, but prepare with other patterns for heart pattern, maybe like the children, just the spirit kind of terminate, 神 disorder in there usually. And the liver disorder usually is the intervened, like we talked about before. So that's usually disorders. But compared with the other three organs, it's not that common. Yeah. So lung disorder, like EPI rating, is more common disorder in the pediatric clinic. And digestive spleen stomach disorder, like diarrhea, vomiting, is another pretty common one. And kidney disorder. The kidney disorder mainly coming from genetic reasons. So that three organs disorder is more common compared with the heart and the liver. Even sometimes we possible can find heart and liver disorder, but not that common. So we're talking about different organs disorder here. When they have trouble, they are pretty easily onset and faster onset, like we talked about before. Like this morning looks pretty good, and then from the noon, they getting sick. And go to evening, they got more severe, more severe. Sometimes high fever, even high fever cause the convulsions. But next morning, they are totally recovered. So we say onset faster and easily, and illness faster changing and faster recovery. Including all the organs disorder, not only in the lung, for the digestion, also, but not truly for the kidney. We say kidney mainly is essence disorder coming from congenital constitutions, thus let it be harder to change it. But for the lung, for the spleen disorder, is pretty easily cause problems and pretty easily recovered. Then we talk about poor and clear, poor yang and clear 脏气. So we're talking about yin and yang should be balanced, But in the young people, young children, they are not totally balanced. We say in part is the body constitutions built up, like we talking about build up the organs. All the organs not totally matured yet. So that's relatively is more young. In not able truly holding yang or control yang. This means yin yang not totally balanced. So young children have more yang. So that's yang easily hyperactivity. So for case problems, because they have more yang inside the body, and they cause problems, pretty easily changing to heat. So compare with the adults, thus we say children have poor yang bodies, and their problems usually cause the more heat problems. But their 脏气 is more clear. What means 脏气 is more clear? It's not invading by the passengers yet. Not like adults. We know in our clinic, when people come in, they may have multiple organs disorder, like liver stagnation, attacking the middle jaw, attacking the upper jaw, cause the insomnia, diarrhea, constipations. So children's problems look like a pretty simple. They only go to one symptom usually. So that's we say poor and clear 脏气, and then people's problems, young kids' problems is quickly recovered. because their body have more yang qi in there, and their organs function is poor zang qi in there. And the reaction for the treatment is pretty well. So case problems usually is acute problems. Occasionally some chronic condition, but usually it's acute problem. And it's easily for treatment and easily recovered. And we say they don't have too much emotions affected with the illness, affected with the treatment. So illness onset faster. We say onset faster. And good reactions will response for the treatment. For the treatment. And after treatment, quickly recover. So that's the pathology part of a pediatric. So that's the mainly like pediatric pathology. Onset faster and good response for the treatment and recover faster. And most problems is acute problems. It's not that chronic problems. So that's today's class. Yeah, that's today's class.